There are 133 crore people in India, but only 10 lakh doctors to look after them. There are 2 lakh rural hospital beds for 6 lakh villages. That's 1 hospital bed for 3 villages. Rural India has 1.5 lakh sub-centers and primary health centers. There is a promise to build 1.5 lakh new health and wellness centers. The truth is, in the last decade, government has added less than 15,000 new centers. Now, this is the setting in which the Modi government has unveiled its Ayushman Bharat mission, or Modi Care as it's politically billed. Modi Care faces a sea of challenges. To be specific, 5 C's: coverage, consensus, conceptualization, costs and capacity. The first C is about coverage. The scheme says it will cover 10 crore families of 50 crore people. The National Food Security Act covers 80 crore people. To argue that those who need help for food security do not need help for healthcare is problematic. The second C is about political consensus. Many states already run well-entrenched health insurance schemes. Tamil Nadu, Andhra Pradesh, Maharashtra and Rajasthan. Leaders like Mamata Banerjee have already voiced their opposition. Why should states merge their scheme into the central scheme without an incentive structure in place? The big worry for the states is that many of those they cover will be left out. The third C is conceptualization. What will the scheme include and what will be left out? And who delivers the treatment? Will it be the public hospitals or the private hospitals? The third C actually has a big role to play in the big C, that is cost. Currently in the private market, an average Joe can acquire a health insurance for rupees 5 lakh for a family of 5 for around rupees 20,000. Obviously, when the government, the big brother, gets into the market, scale kicks in, group insurance will lower the price of the premium. Even if all this were to fall into place, there is the big C, that is capacity. The ability of state and central governments to administer healthcare to citizens. 25% of the posts at rural primary health centers are vacant. The government has sanctioned only half the gynecologists, physicians and pediatricians that community health centers need. And what part of even the sanctioned number is lying vacant? Almost 70%. As a result, 70% is also the share of treatment being provided by private sector. That's the official NSSO data. Paying private sector costs for healthcare when over 80% of India is uninsured means hard to get money is going out of pocket. The cost and consequence of this, it is estimated, pushes nearly 7% of the population below the poverty line. There is no disputing that there is a need for complete overhaul. The issue is not why, but how. The National Health Protection Scheme comes embedded with an opportunity to fix the broken system. Front-loading of affordability will deliver access to healthcare. This can be leveraged to drive investments to fashion a viable model for backward and forward linkages. The question for the center is, why not leave it to the states? Imagine the central government as the incubator of many startups, providing seed capital through a national health mission. Why not allow states to design their own public-private partnership models? States could provide land, use the Mahatma Gandhi National Rural Employment Guarantee Scheme to build the physical infrastructure. They can outsource setting up of health and human resource centers by tying up with private providers of service. Why not ask members of parliament and legislative assemblies to assign at least 25% of their area development funds for setting up primary health centers? For decades, India's public policy initiatives have focused on addressing the consequence, leaving the cause for another day. For Bharat to be Ayushman, it is necessary to invert this paradigm and begin addressing the cause.